Hi, I'm Dr. Corey Moss, a board-certified facial plastic surgeon in San Francisco and an associate clinical professor at the University of California, San Francisco. As the founder and director of the Moss Clinic, we have a comprehensive center here that addresses all areas of the face and body as it relates to cosmetic surgery. My particular interest is in areas of the face and facial cosmetic surgery. One area of particular interest and an area that we've particularly made some significant advances is in the area of brow lifting or browplasty surgery, elevating the sagging brow. And I'd like to tell you a little bit about how we do it, some of the advances, and then show you some pictures of what people can look like before and after that type of surgery. So first, typically with aging, and even in our mid-30s, the brow with gravity effects begins to sag down and you see heavier brows, the eyelid skin begins to hood down over the eyes, and people just get a sort of worried or tired look about them. The older techniques of addressing this issue were called coronal brow lifting techniques, and they were quite extensive with an incision that really went across the entire head, and the entire forehead was peeled down, or incisions were made along the frontal hairline in a wavy fashion. Some cases those are important and may still be applicable if they have a high hairline, but for the most part the newer techniques we have developed allow us to make tiny little incisions behind the hairline and use what is called an endoscope, a lighted telescope. Through those little incisions with a lighted telescope, I can place that down underneath the sagging tissues and elevate everything through that tiny little incision that's sagging down. I can identify the muscles that typically are injected with Botox that create the frown line and reduce their strength by simply doing a little bit cutting or lysis of those muscles. We certainly don't need them. That's an option for all the patients. And then we simply elevate or restore the brow to a more youthful position with an upward and outward vector. That upward and outward vector of pull is maintained with a tiny little drop of biological glue, no drilling in the skull, which is done by many centers, just a little drop of biological glue that goes away in a very short period of time. And that holds the brow in place until it's totally healed. That healing process really only takes about a week. There's swelling in the upper brow, there can be a little bit of bruising around the eyelid itself, but typically people are back doing their normal social functioning things within a couple weeks after this surgery. The incisions being so small, there's nothing really to see in terms of the healing process, and you can restore a brighter, more youthful, more alert and awake look in a very short period of time with an outpatient procedure that doesn't take much longer than an hour. If you're interested in talking about browplasty surgery or any of the other cosmetic facial procedures that we offer, please visit the website. There's a lot of information there, or call our office and make an appointment. I'm happy to do a computer consultation and show you how you'd look before and after the procedure. In fact, let's take a look at a couple of the patients before and after.